So I'm going to be doing my presentation on haemolytic disease of the newborn, which we have covered a little bit in haematology, so hopefully this will be a nice revision for you all. So in this presentation I'm going to be covering the etymology, so hopefully that will be of use. Then I'm going to be talking about the mechanisms of sensitization, because there's a couple of different ways that this disease can come about through different blood groups. Then I'm going to be talking about the consequences of HDN being haemolytic disease of the newborn, so the different issues that the babies are faced with if they are born with this. Then I'm going to be talking about the treatment options, both before the baby is born and after the baby is born, and then more importantly, the prevention, so how it can be stopped from occurring altogether. So first of all, if we take a look at the etymology, haemolytic can be broken down into two Greek roots. So haemo is coming from the Greek haema, meaning blood, and then lytic is coming from the Greek word lysis, which can mean to loosen or to break down. So in this sense, breaking down of blood or of red blood cells. This is also known as haemolytic disease of the newborn and fetus, or this term here, so erythroblastosis fetalis. So erythro is coming from the Greek erythros, meaning red, blast from the Greek blastos, which can mean germ or sprout, but in this sense it's referring to a small cell. And then osis is Greek for abnormal or diseased state, so an abnormal or diseased state of the red blood cells. So this is just a quick introduction and overview to HDN. So it's an alloimmune condition, meaning that antibodies produced by a different person are attacking the cells of the baby. So allo is coming from the Greek allos, meaning other or different. So in this sense it's referring to the mother. So the mother is producing antibodies that are then attacking the baby's cells. Most commonly it is caused by issues with the rhesus blood system, and in particular the rhesus D antigen, but it can also be caused by ABO incompatibilities, but I'll come back to that later. And then the main issue with this is that the babies are born with neonatal haemolytic anemia. So we've covered haemolytic, the etymology of that. Anemia we all know, an meaning without, emia blood, and then neonatal, so neo is Greek for new, natal is from the Latin natus meaning born, so anemia of the newborn. So if we take a look at the rhesus blood system, and this is just really explaining how this disease occurs. So there's something called the rhesus D antigen, and you either have it or you don't have it. So those who have it are obviously called rhesus D positive, and those who don't, rhesus D negative. Most people are positive. It's only around 15% of people who are rhesus D negative and don't have this antigen and therefore have never been exposed to it before. So it's possible that if the father of the baby is rhesus D positive, that the baby can be positive and have this rhesus D antigen whilst the mother is negative. And what can happen is that some fetal cells during pregnancy can move over into the maternal circulation. The mother meets this antigen for the first time and of course will start producing antibodies against it to attack it. And these anti-D antibodies can then go back to the baby's circulation across the placenta and then start attacking the baby's cells. And that's going to be in the form of hemolysis of the fetal red blood cells. So the red blood cells within the baby are going to be broken down due to these antibodies that are produced by the mother, and that's why it's called an alloimmune disease. And the antibodies involved are IgG antibodies, which are able to cross the placenta. However, I mentioned earlier that there are other mechanisms for this disease to occur, so other sensitization methods. Sensitization just means the mother who is negative coming across this antigen and producing antibodies against it. So one way that a woman can be sensitized is if she has a blood transfusion and the blood is rhesus positive, then the mother will produce anti-D antibodies against it, and then later in the future if she decides to have a baby and the baby is positive, those antibodies can then in the future travel across the placenta and affect the baby. Or if the woman previously had a miscarriage and that child was positive and in the past the woman produced these antibodies against them, those antibodies can remain in the circulation, and then later on in life, if she decides to have another baby, those antibodies can then again cross across the placenta and cause HDN in a future child. And ABO incompatibility can also cause HDN, but it's less common and it's less serious than the one caused by rhesus D antigen, and that's because it's a different type of antibody produced. Rather than IgG, it's IgM, and this IgM is unable to cross the placenta, so it doesn't cause as bad effects on the baby. So if we look at the implications of HDN for the child, the main one that we mentioned earlier is neonatal hemolytic anemia, so the baby will be born anemic. The second one is hydromenos, which is excess amniotic fluid accumulation during the pregnancy. This can be mild or severe, but when severe it can lead to birth defects of the central nervous system, so the spinal cord and brain, and it can also cause blockages in the digestive system for the baby. Fetal growth retardation is another issue that can occur, and this is when the baby is not going to reach its potential size that is genetically determined for that baby. Fetal or neonatal jaundice, so as there is hemolysis occurring and red blood cells are being broken down, bilirubin is going to be produced, and this bilirubin accumulation can cause jaundice. And finally, if this is severe, this can lead to kernicterus, which is when the bilirubin is deposited into the brain, and it's a form of brain damage. So this picture here is just showing the signs and symptoms of jaundice and how it can be deposited in the brain as well. So this is a particularly upsetting consequence of HDN. It's called hydrops fatalis. So it's basically when the baby will start to overproduce red blood cells due to this hemolysis that's occurring, and it leads to hepatomegaly and splenomegaly. So megaly is coming from the Greek megal, meaning large, so it's when you get enlargement of the liver and spleen due to this overproduction. This enlargement can cause hypertension in the portal system, and this can lead to very severe edema. It is mostly fatal in nearly all cases, so only 20% of these babies will actually survive to the point of delivery, and then after delivery only half of those babies will go on to survive. But this is not a common thing, it's very rare. So finally, the treatment. There's treatment options before the baby is born and after the baby is born. So before, if it's detected, an intrauterine blood transfusion can occur whilst the baby is still in the womb. So blood which is compatible with the maternal blood will be transfused into the baby so the mother doesn't produce antibodies against the baby's blood. A plasma exchange can also occur, so instead of changing the baby's blood, it's changing the mother's blood, so you can reduce the antibody count. And finally, after birth, if the baby is born with HDN, phototherapy or exchange transfusion can be done to remove the bilirubin and prevent the jaundice from becoming more severe and causing kernicterus. So finally we have prevention, so it's best to just prevent the HDN from occurring in the first place. So every pregnant woman has multiple blood tests during a pregnancy, and right at the beginning of the pregnancy their blood group, both ABO and whether they're rhesus D positive or negative, will be determined. So around 15% of women will be negative, and these women will receive anti-D treatment throughout their pregnancy multiple times, and it's usually through an intramuscular injection. And then after birth, the mother will continue to receive this antibody to prevent her from preventing antibodies against the baby until the fetal cells themselves become negative. So that is my presentation, and thank you for listening.